I decided to go down the road of digital orthodontics because I felt that it would give me more control on my treatment. Digital orthodontics allows you to explain to the patient how their treatment will progress and provide a visual aspect to that treatment. It also helps you plan tooth movements as well as communicate with colleagues and the patient during treatment to show them how the treatment is progressing.
We met Dr. Chattu at the World Conference in 2015. He'd approached several other laboratories and then approached us and asked us if we could possibly generate indirect bonding trays from his lingual bracket setups. And we thought, yes, we'll give it a try.
Once the patient has agreed that they want to proceed with treatment after the initial consultation, we usually invite them back to the clinic to have records taken. Now, records involves a 3D scan, which now replaces taking physical impressions of the teeth. The 3D scan allows us to sort of get this 360-degree visualization of the patient's mouth and their teeth. We are then able to relate that scan to photographs and x-rays to help plan their treatment. The next step would involve sending that digital scan with a setup of the brackets where we want the brackets to be placed on the teeth to a laboratory, and we send this via an online portal and the whole process takes approximately 2 minutes from start to finish.
It first starts with a case sent over to us by Dr. Chattu on our online portal. We'll receive the file from there and we generate a mapping of Dr. Chattu's brackets on the patient's arch. We then create a series of clasps around those brackets, and this is then attached to the pre-treatment model and sent to our 3D printers. Once the model is printed, this can be sent round to our production department and the brackets placed and the appliance made over that.
Through our communication and tight sort of working arrangements, we've just come up with a system whereby we're able to provide brackets for the patient which are very accurately positioned on their teeth to provide very precise movements, and it allows us to look after our patients more effectively from start to finish.
It's incredibly exciting to be working with Dr. Chattu because we are trailblazing. We are doing something that no other laboratory has done before.
I think we're only at the start of the digital technology that's going to enter into everyday orthodontic treatment. The way I see it is that, yes, what we're trying to do is slightly pioneering in its way, but it's only the beginning and things are only going to get better. And I feel that we can push boundaries even further, working with a good laboratory, and it'll all be centered around providing the best possible care for our patients.